Let's see an NCLEX RN video on assessment of gastrointestinal function. The nurse correlates poor dentition in patients to which digestive disorder? Chemical digestion of protein, mechanical digestion of chyme, mechanical digestion of protein, chemical breakdown of carbohydrates to simple sugars. The mechanical breakdown of ingested protein occurs through the process of mastication or chewing. So poor dentition in patient is related to mechanical digestion of protein. The nurse correlates a disorder of which type of cell in the patient with vitamin B12 deficiency? Mucus cells, chief cells, parietal cells, enteroendocrine cells. Parietal cells secrete intrinsic factor, a chemical needed for the absorption of vitamin B12, an important component of hemoglobin synthesis. They secrete HCl. Mucus cells secrete mucus, which protects the stomach lining. Chief cells secrete gastric lipase and enteroendocrine cells secrete hormones needed for digestion. When a physical assessment of gastrointestinal function is completed, which procedure follows inspection? Auscultation, percussion, light palpation, deep palpation. The purpose of auscultation is to indirectly assess bowel sounds and vascular integrity of the arteries. In the assessment process, percussion and palpation usually occurs prior to auscultation, but manipulation of the abdomen can result in inaccurate interpretation of the bowel sounds as being hyperactive. So auscultation is completed prior to percussion and palpation. In assessing the patient with an ileostomy, the nurse focuses on which three S? Sensation, skin, stoma, stool and size. The assessment of a stoma includes the surrounding skin that should be consistent with the rest of the abdomen. The stoma itself should be pink and moist. The consistency of the stool is dependent upon the area of the stoma, and in patient with an ileostomy, the stool is semi-liquid. Which statement by the patient scheduled for an EGD, that is esophago-gastroduodenoscopy, indicates the need for further teaching? I will not be able to eat 8 to 10 hours before the test. My throat will be anesthetized so the provider can pass the tube. I will probably have a sore throat after the test. It is important that I eat extra fiber after the test. So there is no need to increase the fiber after the test as it does not include barium that could cause constipation. The patient is maintained NPO after the EGD until the gag returns, and then the diet is advanced to fluids. The patient can return to their normal dietary intake upon discharge. The nurse recognizes that an impairment of which cranial nerve makes a patient at risk for aspiration due to ineffective swallowing. Trochlear, trigeminal, vagus, accessory. The cranial nerves involved in the effective swallowing include cranial nerve 5, that is the trigeminal, cranial nerve 7, that is the facial, cranial nerve 9, that is glossopharyngeal, and cranial nerve 12, that is hypoglossal. The trochlea, the cranial nerve 4, involves movement of the eye. Cranial nerve 11, accessory, controls contraction of the neck and the shoulder muscles. And cranial nerve 10, that is the vagus, affects peristalsis. So here it is the trigeminal. Patients experiencing diarrhea are at risk for which alteration in absorption? Decreased chyme absorption, increased chyme absorption, decreased potassium absorption, increased potassium absorption. The function of the large intestine is fluid and electrolyte reabsorption and elimination. So here the patients experiencing diarrhea are at risk for decreased potassium absorption. The nurse places the patient in which position for a gastrointestinal assessment to promote relaxation of the abdominal muscles? Sitting upright with arms relaxed in the lap and feet on the floor, semi-recumbent with knees extended and arms at the sides, side lying with arms above the head and knees flexed, supine with arms at the side and knees flexed. Patient should be supine with arms relaxed at the sides and bent knees in order to promote relaxation of the abdomen. The nurse correlates an increase in which laboratory value to the diagnosis of acute pancreatitis? Serum sodium, serum amylase, serum potassium, serum creatinine. Amylase is an enzyme responsible for digestion of carbohydrates and it is produced in the pancreas. When the pancreas is inflamed, amylase is released in the blood. The nurse monitors for which complication in the patient who has undergone a barium enema? Fluid overload, dehydration, diarrhea, constipation. When the barium is not properly eliminated, it can harden and can cause constipation. The nurse correlates which clinical manifestation as a normal age-related variant in an older adult? Diarrhea, melena, constipation, anorexia. Due to decreased peristalsis in an older adult, constipation is a risk factor. Mr. Jain, a 70-year-old male patient, presents with complaint of worsening heartburn that has persisted over the last 3 months. He also reports nausea, decreased appetite, abdominal bloating, frequent belching and gas. He states that there is burning pain in the stomach until he eats. Symptoms persist despite dietary changes and treatment with over-the-counter antacids and H2 antagonists, which have worked in the past. He reveals that his last bowel movement was several days ago. He reports having difficulty with bowel movements since he retired last year. He noticed that his stool was darker than usual but thought it was from the Pepto-Bismol that he had taken. He denies laxative use or abuse. Mr. Jain also reports feeling tired and complains of lightheadedness when moving from sitting to a standing position. The patient has a past medical history significant for hypertension, myocardial infarction, and hypercholesterolemia. He reports drinking a glass of wine with dinner every night and being a former smoker. Mr. Jain states he smoked about 1 pack of cigarettes per day for 20 years. He currently takes lisinopril 20 mg per oral daily, clopidogrel 75 mg per oral daily and atorvastatin 10 mg per oral daily. He has not taken any medication in 2 days. The physical examination reveals the following: vital signs: temperature 97.8 degree Fahrenheit, pulse 115 beats per minute, respiration 18, supine BP is 130 by 80 mmHg, standing it is 100 by 60 mmHg. Abdomen is soft, round and slightly distended and tender. Hypoactive bowel sound present in all 4 quadrants. No superficial vessels or lesions present. Generalized tympani with dullness noted in the left lower quadrant on percussion. Skin is warm, dry, flaky and intact. No palpable mass is present. Fecal occult blood testing results are pending. On the basis of the assessment findings of the case study, which requires immediate follow-up by the registered nurse. Reported bowel movement several days ago, missed dose of lisinopril, hypoactive bowel sounds present in all quadrants, BP 130/80 mmHg standing and 100 by 60 mmHg. So here, the decrease in blood pressure when changing from a supine to a standing position is indicative of decreased intravascular system that requires immediate evaluation due to the patient's complaints of lightheadedness when changing position. So in lying down and in standing, there is variation in BP which needs to be evaluated. Which subjective and objective data support the order of fecal occult blood testing? Reports of stool darker than usual, reports of feeling tired and complaints of lightheadedness when moving from a sitting to a standing position, clopidogrel 75 mg per oral daily, skin warm, dry, flaky and intact, heart rate 115 beats per minute, respiration 18, supine BP 130 80 mmHg and standing 160 mmHg. So the subjective and objective data that support the order for fecal occult blood testing, they are: first one, report of stool darker than usual. That could be an indicator of gastrointestinal bleeding. Report of feeling tired and complaints of lightheadedness when moving from a sitting to a standing position could be an indicator of volume loss. Clopidogrel 75 mg per hour daily. This drug can cause GI bleeding. And the heart rate, respiration and the change in BP could be an indicator of volume loss. Which statement by Mr. Jain regarding the endoscopic procedure indicates that further teaching is required? I can eat solid food 3 hours prior to the procedure. I can eat solid food 12 hours prior to the procedure. I cannot eat or drink 1 hour prior to the procedure. I can return to my normal diet after the procedure. So further teaching is required when the patient says, I can eat solid food 3 hours prior to the procedure. Here the patient should remain NPO for 12 hours prior to the endoscopic procedure. Mr. Jain returns to unit after an endoscopic gastroduodenoscopic procedure. The nurse will prioritize the intervention in which order? Vital signs, focus physical assessment, start diet and discontinue IV fluid. Focus physical assessment, vital signs, discontinue IV fluids and start diet. Discontinue IV fluids, vital signs, focus physical assessment and start diet. Start diet, discontinue IV fluid, focus physical assessment and vital signs. After any procedure in which the patient receives sedation, the patient should be assessed for hemodynamic stability and orientation, assessed for return of gag prior to oral intake. So vital signs, focus physical assessment, start diet and discontinue IV fluids. The biopsy results are positive for H. pylori. Which statement by the patient indicates understanding of these results? There is no cure for this disease and I will have it for the rest of my life. I hope that I don't pass this on to my wife. I think I contracted this infection from eating shellfish. I will need to take antibiotics to get rid of the infection. H. pylori is curable and should be eradicated after an antibiotic regime. So I will need to take antibiotics to get rid of the infection is the correct statement. Hope you understood this video. Thank you so much. Keep watching.